There are several terms that we'll use consistently throughout this lesson. So one being the toxic dosage level. The toxic dosage level is the level of an antimicrobial agent that would be toxic to the host. So, for example, with some bacteria, when they die, they can release toxins. So for those types of bacteria, it's often better to kill them slowly over an extended period of time so the toxin is slowly released and our body can filter through it. If you took too high of a dosage all at once, it could kill the bacteria too rapidly, cause the release of a high amount of toxin, which could be potentially harmful to the host. And then also some antibiotics can have a really negative impact on our normal biota, especially within the gastrointestinal system. So high concentrations of those antibiotics could be potentially toxic and harmful. What is ideal and what is typically what you get prescribed is the therapeutic dosage level. So the therapeutic dosage level is the level that is going to successfully eliminate the pathogen if maintained over a period of time. So this is what we kind of figure out when we do that minimum inhibitory concentration. That gives us the therapeutic dosage level so that we can prescribe. And that's going to get rid of the infection without causing any potentially harmful side effects to the host. The key thing here is it has to be maintained over a period of time. So if a particular dosage of an antibiotic is prescribed to you for a 10-day cycle, you have to take it for the full 10 days in order for it to be effective. Yes, you will likely start to feel better after 3 or 4 days because you have killed a high amount of the bacteria, but you can't stop taking it early just because you feel better. That you still potentially could have some bacteria in your system that's causing the infection, and if you stop taking the antibiotic early, they could potentially come back. And if they come back, you're going to get sick all over again. Now you don't have a full, supply of antibiotics to take to cure the infection. Also, when we expose bacteria to antibiotics, they can be prone to become resistant. So with you not taking the full course of antibiotics, there is the possibility that they gain resistance and the antibiotic that you were currently on is no longer going to be effective, and you would have to go back to the doctor to get put on a new, stronger antibiotic. So just a life lesson. Don't stop taking them early just because you feel better. You have to take the entire course. The only reason you should ever stop taking them early, or stop taking them, is if you're having an allergic reaction to the medication, or if you're having very bad gastrointestinal symptoms, because some antibiotics are really hard on your GI tract and can lead to vomiting and diarrhea, which can cause dehydration. So if those types of things are happening, you would obviously stop the medication, go back to the doctor, and get put on a new antibiotic. But if you feel otherwise fine, do not just stop taking it because you feel better. Another thing we'll talk about is the chemotherapeutic index. The chemotherapeutic index is really a formula that we use to do a calculation. You're not going to be doing the calculation though, but the calculation is basically to take the maximum tolerable dose per kilogram of body weight and divide it by the minimum dose per kilogram of body weight that would cure the disease. So basically you're taking how much your body can handle without having side effects, divided by how much is required to cure the infection. And that's going to give you a number that we call the chemotherapeutic index. You'll likely, if you're going into any of our healthcare programs, have to take a dosage calculation class where you'll discuss this. For micro, I just need you to remember a simple rule, and the rule is the higher the chemotherapeutic index, the safer the drug. So if you ever have a choice between multiple medications that would work, and you know their chemotherapeutic index, you always choose the one that has a higher chemotherapeutic index. That is going to be the safest drug. So for example, a chemotherapeutic index of 10, that's a high chemotherapeutic index. That would be an ideal drug to take. However, a chemotherapeutic index as low as 1, that could be a potentially harmful medication. And while you still may need to take it because it's the only medication that can cure the infectious disease, you would need to acknowledge that there's obviously going to be some side effects with taking that medication. But as a general rule, we would always choose the medication that had the highest chemotherapeutic index. So medications such as antibiotics that have a high chemotherapeutic index and are, termed as kind of safe medications would also have really good selective toxicity. Selective toxicity is something ideal that we want an antimicrobial agent to have. So selective toxicity is the ability for an antimicrobial agent, such as an antibiotic, to destroy the pathogen, but not the human host cells. So when we take an antibiotic, we want it to go in and target the bacteria, but not harm in any of our human host cells. So for example, a drug like penicillin has a very high chemotherapeutic index and really good selective toxicity. Because the way penicillin works is it destroys peptidoglycan in bacterial cell walls. So when you take penicillin, you know it's only going to destroy bacteria because only bacteria have peptidoglycan in their cell walls. Penicillin's not going to harm any of your human cells because your human cells, not only do they not have a cell wall, they don't have peptidoglycan. So penicillin can't do anything to human host cells. It can only act on bacterial cells. So it is quite selectively toxic in the sense that it's only going to be toxic towards bacteria and not host cells. Not all medications maintain selective toxicity though. So one example is amphotericin B. Amphotericin B is it's an antifungal medication. It's often used to treat histoplasmosis, which is a fungal lung infection that can be quite dangerous. So patients need to take this antifungal amphotericin B. The way amphotericin B works is it destroys sterols in the cell membranes of fungi, and that ultimately kills the fungi and cures the infection. A downside, though, is that we also have sterols in our cell membranes. So while the amphotericin B medication is destroying fungal cells, at the same time, it does destroy some healthy human cells. So there obviously are side effects that go along with taking that medication. Do you still need to take the medication? Yes, because the risk of not taking the medication is much worse. But you just need to understand, because it has low selective toxicity, there's going to be side effects that happen from taking that medication. Another concept that we talk about with antibiotics is their spectrum of activity. So basically with antibiotics, they have two different spectrums of activity, broad spectrum and narrow spectrum. So antibiotics that are able to target a wide variety of bacteria are broad spectrum drugs. So if there's an antibiotic that can target both gram-positive and gram-negative bacteria, it would be considered a broad spectrum drug. Tetracycline is an example of a broad spectrum drug that targets a wide variety of bacteria. Narrow spectrum drugs target a specific type of bacteria. So for example, isoniazid is an antibiotic that's used to treat tuberculosis. It targets Mycobacterium tuberculosis. But because it targets that specific bacterium, it is considered a narrow spectrum drug. I will say broad spectrum drugs are the default. Most prescribers prefer broad spectrum antibiotics because they can be used to treat all different types of bacterial pathogens, anywhere from urinary tract infections to ear infections to upper respiratory infections to skin infections. Broad spectrum antibiotics are very easy to prescribe in the sense that you don't really need to know the causative agent of the infection because the broad spectrum drugs target so many different types of bacteria. Whereas with a narrow spectrum drug, because they only target a certain type of bacteria, you would obviously need to know what was causing the infection in order to prescribe the appropriate narrow-spectrum drug. The problem with broad-spectrum drugs is the same thing that's good about them. They target a wide variety of bacteria. So when you take them to cure an infection, they can really damage your normal biota, your good bacteria, and that can create some problems that we'll talk about next. So one potential negative side effect of taking a broad-spectrum antibiotic is that they could potentially cause a superinfection. So a superinfection is a secondary infection that happens after taking a broad-spectrum antibiotic. So let's say you go on a broad-spectrum antibiotic because you have some type of infection, ear infection, UTI, whatever. So you take that broad-spectrum antibiotic and it's going to get rid of whatever causing your infection, so that's good. But at the same time, it wipes out all your normal biota, your good bacteria that's supposed to be there and can actually protect you against other pathogens. So it wipes all that out too. If there was any pathogens left behind, they now have the space and the nutrients to grow out of control. There's nothing keeping them in check anymore because now the normal biota are all gone. So if they were left behind, they now have the opportunity to grow. And when they grow, they can make you sick with a secondary infection that we know as a superinfection. So a superinfection happens after taking a broad-spectrum antibiotic and the normal biota is depleted, allowing any pathogens that were left behind to then grow out of control and cause that secondary illness. There's two common examples of superinfections that result from taking broad-spectrum antibiotics. The first being a yeast infection and the second being antibiotic-associated colitis, which we just often refer to as C. diff. So let's say you go to the doctor because you have a urinary tract infection, and UTIs are often caused by E. coli, but since the urinary tract is supposed to be sterile, any bacteria that get there could cause an infection. So because many different types of bacteria can cause a UTI, the prescriber is likely going to give you a broad-spectrum antibiotic. So that broad-spectrum antibiotic gets rid of the urinary tract infection, so that's good. But at the same time, that broad-spectrum antibiotic wipes out your healthy bacteria in the vagina, which are lactobacilli. Lactobacilli are supposed to be in the female vagina. They actually keep the environment acidic and prevent yeast from growing out of control. But if you take a broad-spectrum antibiotic to get rid of, another infection, that can also get rid of the lactobacilli in the vagina. So now that acidic environment is gone, and any yeast that were there, such as Candida albicans, can now grow out of control, and then you get the superinfection, which is the yeast infection, the kind of secondary infection, which at that point you would have to get on antifungal medication to help with that. Another example is antibiotic-associated colitis, or C. diff. We all have a small concentration of Clostridium difficile, the bacteria that causes our C. diff, in our large intestine. But it's kept under control by our normal biota. As long as our normal biota is present, C. diff cannot grow out of control. Again, if you get put on a broad-spectrum antibiotic for something else, it wipes out your normal biota, keeping C. diff behind. C. diff now has the space and the nutrients to grow out of control as it will, and then you get antibiotic-associated colitis or a C. diff infection. So that could cause vomiting, cramping, diarrhea. It's a pretty nasty infection. It does need a different antibiotic to be treated, so then you would have to go back to the doctor and get put on a different antibiotic now to treat the superinfection, the secondary infection, which is C. diff. C. diff is very common in healthcare facilities, specifically nursing homes, where patients are on broad-spectrum antibiotics chronically for various different infections at any given point. And again, it wreaks havoc on the normal biota. And then C. diff have the opportunity to grow out of control. So broad-spectrum antibiotics, while they're great, they definitely do have the negative side effect of potentially causing superinfections.